So, good afternoon, everyone. Welcome to this month's Durham County Opioid Settlement Advisory Committee meeting. My name is Shalisa Howard Martinez, and I serve as the co-chair for this committee along with Brittany Price. Before we get going with the meeting, I thought it'd be great if all of the committee members could just go around and just introduce ourselves. People are still getting to know each other's names. And if also after you introduce yourself, you could just pass it on to someone else. So I'm going to start with Jamie.
Hey, I'm Jamie Carter. I'm a primary care and addiction medicine doctor at Lincoln Community Health Center, and I'll pass it to Dawn.
Good afternoon. I am Dawn Baxton, and I am a Chief Public Defender for Durham County. And I will pass it to Christy.
You could probably pass it to the next person.
Okay, I will pass it to Brittany.
I'm so sorry, I just got here. Are we introducing ourselves?
We are.
Okay, great. Thanks. Hi, I'm Brittany. I use she, her pronouns, obviously live in Durham. I work as an evaluator on several national level funding opportunities for harm reduction programs. And so I'm here in the healthcare payer and funder seat. And I will kick it over to Karen, I guess. Have you gone?
I have not. Hey, everybody. I'm Karen Kelly. I'm the Chief Program Officer at TROSA, and I will kick it over to Lofton.
Thank you, Karen. I'm Lofton. I'm an outreach worker with the North Carolina Harm Reduction Coalition. I'm on the lived experience seat on the committee, and I am out in the mix right now. So I will be as present as I am able to, but not as present as I would like to. And I can't figure out how to see who all is here, so I don't know who's gone or not, so I will allow somebody else to jump in.
It might be me, so I'll jump in. Hi, everyone. Wendy Jacobs. I'm a Durham County Commissioner.
And Paul
Oh,
or Alonzo? Yeah.
I'll jump. Paul Nagy, evening, everybody. Sorry to be a little bit late. I am employed with Duke on the faculty in psychiatry. I'm a licensed clinical mental health counselor and licensed clinical addiction specialist.
And Alonzo, I think you may be the last committee member.
Hi, everybody. Good evening. I'm Alonza Pamplin, and I am a resident here of Durham, North Carolina. I also serve on the Durham County Women's Commission as well.
Thank you. Are there any other committee members who haven't introduced themselves? Okay. So the next thing on our agenda is announcements. So does anyone have any announcements that you would like to share with the group? So I'm not hearing any announcements. So our next topic is to review and approve the minutes from our March meeting.
This is Wendy. I would move for approval of the minutes.
Okay, thank you, Wendy. We were going to, Jason, are you going to display the minutes or do you want me to just in case someone has a question or something?
Sure, I can certainly do that. Let me go ahead and get up here.
Yeah.
All right, please just confirm once you're able to see. Hopefully you can see that. Are you guys able to see that? Okay, perfect. I can enlarge it a little bit.
Does anybody have any questions or comments? Okay, so we've already had a motion to approve by Commissioner Jacobs. Do we have a second?
I'll second. This is Dawn.
Thank you. All in favor? Thumbs up, or you can say
Aye. Favor.
Aye.
aye. Looks like our meeting minutes are approved from March.
Hi, everybody. This is Christy Malott, and I work in the county attorney's office. I just want to remind you that because you're subject to open meetings laws, it's important to vote out loud for the minutes.
Okay. All right. Thank you so
Thank
much
you.
for that reminder. So perhaps we should do the vote again. So everyone in favor of approving the March meeting minutes, please respond with aye.
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 Any opposed? Okay. All right. So now we're going to move into the recommended strategies for this year's or for next year's funding. And so Jason is going to provide us an overview about the strategies. We also have some time to provide feedback. And of course, I know several committee members have questions about this. And so after that, we're going to then get into looking at the actual recommended applicant. So I'm going to turn this over to you, Jason.
All right, perfect. Let's see if all right, perfect. One second, I'm gonna get this on my screen here. I actually put together just like a really brief PowerPoint presentation just to have some visuals around the conversation here, just to kind of set the platform here. So hopefully you guys can see my screen here in just one second here. All right. Hopefully you guys can see my screen. All right. First off, hello, good evening to everyone. Have a couple different things here on my screen. It's good to see everyone here tonight. So first, as with this part of the agenda, just want to kind of ground us in the overall process. We had our last meeting that we shared. I shared an RFP update in regards to our process and everything that we've done so far. Just to kind of really give a high level before we get into the voting part of this, in which Salisa will lead. So just want to kind of give a high level process, high level understanding around what we did. So the county, once again, county recommended increasing funding going directly into the community. And so with the opioid settlement funds, this is before the RFP process. And then that kind of resulted in the community 50% going towards the county and around 50% going out into the community. So with that being said, to support those efforts, we released the RFP in December 2025. You guys, once again, I said all this in the last meeting, but results were we had 10 organizations that applied, but we received 17 applications from the community-based organizations, CBOs, and then 2 were screened out because they did not meet the eligibility criteria that was outlined in the RFP. So the remaining applications then were advanced into full review and also a ranking process. And as a reminder, this portion of the process was, like I said, I kind of mentioned this a little bit back in March. And so just so everyone can see, we had a working group that was made up of 5 individuals. We have Dr. Jeffrey Jinks, we have Cassandra Kiger, those are with the county. Then we also had OSAC members Paul Nagy, Dr. Jamie Carter, and also Dawn Baxton, who reviewed, scored, and also ranked all of the eligible applications. We use the 5 standardized criteria that were outlined in the RFP, which includes the project narrative, the community need, which is like the assessing the community need, organizational readiness, performance and evaluation, and also county integration. In addition, all members did receive on the advisory committee were given access to the full set of applications to really support the informed review and also participation in today's vote. And my last slide here. So we're not super slide heavy, but I just wanted to take a moment to just really clarify just a few points before we move on into the voting. We'll be dealing with the recommended strategies and also the recommended applicants today. But the recommended strategies and the applicant that you see or that you will see, they are recommendations only and they are not final decisions. I also want to be clear too that there have been no finalized OSAC recommendations before this meeting. OSAC recommendations will occur through this committee's formal vote. And we thought that it would be a great first step to just do kind of a working group instead of having everyone on this group handle all these applications. So grateful for the volunteers that were able to put the time in and give us these recommended strategies and also applicants. Also want to clarify as well that with these recommendations, the final authority and the decision making ultimately rests with the county commissioners. Okay, they can determine how much funding is allocated, including how much is directed to the county versus how much is going to be directed towards the community. So the committee here is going to give the advice or the recommendation. It's going to be the commissioners that are going to decide. All right. So as they are the governing body, and this is all stated in page 4 of the NCMOA. From here, we're going to move into today's action. That's pretty much all I have to say. Really, this will be facilitated by one of our co-chairs here, Shalisa Howard Martinez, and there will be 2 votes. The first will be on the recommended strategies, and then the second will be on the recommended applicants. And also, before we move into voting and discussion, which you guys will have this opportunity and time to do that. I just also want to take a moment to address conflicts of interest as well. If any member has a real or perceived conflict of interest, related to any of the strategies or the applicants that we'll be discussing, now is actually the time to disclose that. All right, so just so quickly before we disclose, a conflict could involve a financial interest, involvement with an organization applying for funding, or any situation where your ability to remain impartial could reasonably be questioned. So if you do have a conflict, please state it now, and then plan to recuse yourself from discussion and voting on that specific item. So I'll pause for a second just to allow anyone to share if they have any conflicts.
Hello. Hi, Jason. Thank you. This is Lofton. I'm going to recuse myself because my organization applied for funding. So I'm going to hop out of the meeting now and I'll discuss.
All right. Thank you, Lofton.
Jason, this is Dawn. There were some I didn't score because of a perceived conflict. So I just bring that to your attention. So I probably need to also, if those come up, not necessarily discuss it.
And Jason, I just had a question. With how are in this process that you all participated in, how did that impact the was there a decision made then to cut funding to existing programs? I'm trying to understand, how do the existing county funded programs play into this?
Yeah, absolutely. So we put out a flyer across the county in December for county based programs that want to apply for funding. And then with the county, they send in a budget request. So that would be public health for any other departments that were interested. They would send in a budget request. And what that is, they would give out their line items and then also justification around how they wanted to spend the funding. Now, it does play into the funding aspect of this. In terms of, we had $1.5 million as a cap for this. And because of county management wanted to do around half in the county and half in the community, that's leaving us with around $750,000 split both ways. With that being said, we had about $6 million, probably a little bit more than that, but close to $7 million worth of requests. That's total across the county and the community. So what we did was we've been in talks to ask for an increase of that cap from $1.5 million to $2.2 million to try to see if we could fit in more organizations there. There have been potential slight cuts across county funding, but no personnel is being affected. I think there could be some operational things that could be affected as well. But we're still trying to figure out how to scale the actual budget down. So with that being said, we bring it to y'all's attention to have this discussion to see, recommend the strategies, the top strategies that you guys want to go forward with, and also the applicants that were recommended as well.
Okay, and I also just want to clarify, because you made a comment where you said funding going to the county versus the community, but a lot of the county programs are providing funding to the community because, for instance, our naloxone program, we are partnering with the Harm Reduction Coalition, and the syringes, the funding for syringes, we're partnering with a community organization to actually do that program. So I just wanted to clarify that it's not like these are separate
Agreed.
programs. Yeah.
Yes, ma'am. I'm glad you brought that up. Thank you. Because we have a ton of existing partnerships that we already are working with that already exist. So
yeah.
Yes, ma'am. Thank you. All right. Like I said, I think that's it. So Lisa, I'm not sure if there's any discussion that wants to be had, or I kind of open the door to you guys. Like I said, when it is time to vote, kind of as Chrissy mentioned, we'll do a roll call vote where each member will state their name and their vote, yes or no, when you guys get to that point. And that's all I have at this point.
Thank you, Jason. And so there are 12 strategies. I believe there was just one category that did not receive any applicants, and it was for the employment-related services. And so now we need to basically prioritize or identify the strategies that we want to recommend for funding. Does anyone have any questions or comments that you would like to offer, like before we get into that process, for this process?
Yeah, I have a couple of follow-up questions based on what Commissioner Jacobs was asking. I'm wondering, I guess, first of all, like whether the county programs, like the currently funded programs, were aware that there was going to be a reduced amount of funds available to them. And then I'm also curious about, I guess I feel hesitant making these assessments with like community orgs in conversation with county orgs when we don't have access to the same information, like application information for the county orgs. Like it feels like we have a little like they're at a disadvantage in some way, right? Because we don't have this same, they're subject to the same process on our end, but not to the same process on like the entry to this process. Do you know what I'm saying?
I understand what you're saying. Does any because their funding request is through their budget, right? And so does anyone have any thoughts or, response to what Brittany has just shared, her concerns about looking at the county departments and then making sure that there's parity or equity of community-based organizations?
I'd like to make a comment, and maybe I'm not, I might be confused, so I apologize if this has been clarified and I'm not getting it, but it is, am I understanding that that the funds that are going to county agencies have already been decided? Is that, and our recommendation is just for the community groups? I'm not quite understanding where we're at in this process, I think.
And so Jason and maybe Commissioner Jacobs, could y'all respond to that question about the county departments funding requests? Have they been approved?
No, nothing has been approved at this point in time. We receive requests, and it's literally just what that is. It's a request. And so, with that being said, we hope to utilize this committee to be able to have, and once again, we're 6 months into this, but the end goal here, because the end goal of this is to have a strategic planning and enough information to go forth, so that way it'll help inform our actual funding efforts. But at this point, we are in the midst of developing our strategic planning, and as well as trying to recommend strategies, which is understandably confusing, right? Because we don't have our collaborative strategic planning process done. So right now we have county requests, and we have, which is their recommendation. This is what public health is requesting. This is with Office of Emergency Services. This is their request, right? These are the county requests, and we put those amounts out there as well to you guys as well. And that is the PORT program. That is the naloxone program. Those are the programs that came before you guys this year. There were, I think, one other program was the Justice Service Department is the only additional department that would be different, and that was the Drug Treatment Court program as well. So those are all the requests that have come forth, and we await recommendations for you guys across community-based organizations, but also yet across county programs if you wanted to. Now, I think, that's a bit of a slippery slope because once again, all these recommendations will go forth, and this would go towards like county management to be shaped, to see how do they integrate with the county processes and programs, and what's the best way we can make the most impact with that. So once again, we're trying our best to form the best recommendations to go forth and present that to the county commissioners.
I
Please let
guess,
me know where I can clarify some more.
yeah, okay, so while we are primarily here to make recommendations, it sounds like on the community-based applications, that's like inextricable from the funding that could potentially go to the county, right? Like the programs that have already been funded in the past. So like that funding is all coming from the same pot, but we are not considering or considering, I guess I don't quite understand like how we could make decisions when it's all the same money, like just about where that's
So this,
allocated. And
I would say,
also, may
Brittany, really quickly, split it in half because one of the recommendations was that 50% of this is going to go to the community. So don't think about the other half because that kind of is already kind of earmarked. So 50% is planning to go to the county, 50% is planning to go to the community.
okay.
So we are focused on the community part. Focus on the 50% that's going to go towards the community. But if
So
you, I mean, yeah. Yeah.
So in other words, it's not on the table for us to recommend that the county programs that have already been funded, that it sounds like put in budget proposals for the full amount that they had before. I guess I don't understand if they knew that the pot of available funding to them was reduced this year, and whether it is an option for us to say, because of this, we recommend to continue with the previously funded programs.
Yeah, I mean, I think this is a collective discussion that you guys feel like you guys want to do. Once again, we have all these applications that are before us, and yeah, I think this is the point of this. That's kind of the point of this
Jason,
discussion. Yes.
sorry, Jason. I guess my question is, did the county departments know that the pot of money that they were applying toward was going to be reduced from last year?
So the pile of money is not actually being reduced.
So the 750, so like the $750,000 that's set aside for the county, that's not a reduction from what was set aside last year.
We're actually trying to do an increase of about $750,000 because of the increase of RFPs. So the last 2 years we haven't done an RFP process
Correct.
at all for that, right? So we haven't done that. So this is the first time that we've done this process, which has now made us do a very different approach on how we are funding these. I mean, potentially funding these applications. And so with that being said, yeah, go ahead, Brittany, go ahead.
So the funds that we're looking at today, I guess, like
Yep.
my understanding from that spreadsheet that we got
Yep.
is that overall across community and county programs, there was over $6 million requested. We currently, without this potential increase, are looking at allocating $1.5 million. The county program requests, as far as I understand, are pretty aligned with what they had last year. And if we were to split that $1.5 million down the middle, that would represent cuts to the county programs. And I'm curious about if the county programs were aware of this when they submitted their budget proposals.
I believe yes, they're very much aware that this was just a request.
But were they aware that the available amount of funds overall to county programs was reduced from this funding pool?
Yeah, I don't know if maybe Director Jenkins or Kristen can add to this question here. I mean, I'm not understanding her question correctly.
So, Jason, what she's asking is when the county agencies begin to do their budgets, did they know previously that their budgets would need to be reduced? No, they didn't. They submitted budgets, and some of the budgets were very large. And I think during a meeting, I think you told everyone, you may have sent that information out, that once we go to Core NC, because you have to take those budgets to Core NC, and they would determine if some of the allowables were, or some of the deliverables and some of the asks were going to be accepted. And so if they weren't, that would reduce everyone's budget. And then when we begin to look at that 1.5 million and 6.1 million came in, we knew that if we wanted to fund, or if it was recommended to fund multiple programs, then everyone's budget would be reduced. If that makes sense. I think it was Brittany.
Yes, thank you so much, Kristen. That answers my question.
Brittany,
You're welcome.
Rod Jenkins, Public Health Director here. Absolutely correct. Everything Christian said is correct. When we receive the county's requests, we didn't put any necessary limitations on how much to ask for. So you're absolutely correct, Christian. We had some pretty exorbitant requests, and as is the case with our budget with the county, we do have like many departments that have some outlandish requests, and then reality hits, and then we have to say, hey, we need to kind of bring it down a little bit, or you just probably can't get it this year, or half it, whatever have you. But the county does understand a couple of things. Excuse me. We understand that there are some county needs. There are some county programs that has been well established and partnerships to help fund it, as Commissioner Jacobs has eloquently said earlier. We do have partnerships for the naloxone distribution. But then we also were in somewhat of a quandary because we want to get this money out into the community. We don't want the county to hog it all. So Jason has the terrible job of helping you all do that delicate dance and get that balance. And thus the reason why we're having this here. But Brittany, you're asking some excellent questions, and you're certainly hitting the nail on the head as to what we have been going through for the past couple of months, as in trying our best to strike that balance in anticipation of this meeting. I hope that helps.
Yeah, thank you, Dr. Jenkins.
Absolutely.
Any other questions?
Yeah, I'd like to chime in on this. Just I think if I'm understanding things correctly, if we look under strategy 7 at naloxone distribution, we previously is there a cut in the current proposal for the public health department to have their funding cut, the funding that they are using in partnership with harm reduction to get naloxone out?
I would say that I think there is a proposed cut for the Department of Public Health for that naloxone distribution specifically. Yes, I believe so.
So then I guess my concern would be if we've got if it's working, and I'm assuming it is, my understanding is it's working well with that partnership. I have concerns about cutting funding that is going in partnership with a community group, to then potentially fund an organization to provide naloxone that's never done it before. I don't know. I guess I'm not totally clear on why we would call that only government funding, only county funding, and also not sure if maybe you guys can help me understand where this 50-50 split recommendation, where that recommendation came from.
Sure. I don't know if anyone wants to keep going and ask questions. I'll get to that, Karen, unless someone wants me to answer now. I do see other hands.
Karen, I'll just say thank you for your question. I'll just say we do realize, I mean, everything you're saying is spot on. We're established. We have a nice flow going on, but at the same time, we do realize that these monies are for the community to some extent. So it's not that we had any heartburn about it. You know, of course, some of the cuts kind of caught us off guard, but at the same time, when it was explained that, you know, we just can't have it all, and we certainly need to make sure that the community gets a part of it. The only thing we did is just retool, as we do in public health. You know, we just kind of like retooled, regrouped, regathered, gathered our thoughts, and we just said, hey, we have other avenues that, you know, we can use. If this is an opportunity for one of the community grassroots organization to get started, and it's not seed money or anything, they have it, you know, they have it straight, and it's in accordance with the parameters of our program, then we almost owe it to the community to help them get started. We're making so much progress with naloxone distribution. We're seeing the numbers go down, so we certainly want to keep that momentum going. So I think in essence, I'm saying, like, through the budget process, you know, we have winners, we have losers. Sometimes we come out on top, sometimes we don't. You know, sometimes we have to take a blow to the stomach as far as the cut. But we do our best to just really find other avenues to approach. I maintain an excellent relationship with the state as one of the leaders, public health leaders at our executive association. And whenever opportunities are presented from the state for naloxone or whatever, grant monies or whatever, we're first in line. So I did not necessarily take it as a slight. I just said, hey, let's get that money to the community. I hope that helps.
It helps. Is naloxone one of the places where a place like harm reduction was getting support, financial support to help the county do naloxone distribution?
To my understanding, Ms. Karen, the answer is yes.
Yes.
Okay, so then my concern is if we cut that funding and they didn't know that funding was going to get cut, they didn't necessarily put in their own proposal to get that funding directly from this pot of money. And so I totally get it. I work in a nonprofit. We often are having to make adjustments due to budget issues, but I don't want to create a self-inflicted wound for an organization that's been doing great work in the community. So that's my concern about this gray area between what's considered a community organization and what's considered county money. Because while the county might not lose employees, I don't know what the effect on the partnering community organizations is with these cuts.
Well, I do see Commissioner Jacobs' hands up, and I'm pretty sure she could speak to a lot of the challenges they face as commissioners during the budget process. But I think I'll just end by saying to Karen and this group that we always find a way, to make things happen. We have tremendous support from commissioners like Commissioner Jacobs and the county manager, Manager Hager, and the Board of Health. So, I mean, we always find a way to make it help. And I'd be remiss if I didn't say the support from the state has also been tremendous. They reward those communities and those localities that have efficiency and can get the money spent. So oftentimes we're first in line because of groups like this. So I think that we'll be all right, but certainly interested in hearing what Commissioner Jacobs has to say.
Yeah, I appreciate the different issues that were advisory committee members are raising. And I want to say I have been a part of these issues since 2017. Dr. Wanda Boone and I have been chairing Durham Joins Together to Save Lives since then. And a lot of the strategies that we've been implementing in Durham and that have become integrated, honestly, into the fabric of Durham County government have come through evidence-based practices that we've learned now almost 10 years. And I think there are a few challenges. I agree. We definitely want to figure out how to expand the reach of the opioid funding and try to support community-based organizations that we know have demonstrated that they are using best practices and they are being successful. But when I look at the funding currently for the county right now, number one, Jason's position is being funded, okay, through the opioid funds. The second thing is a recovery recovery support services, our community linkages to care program. That is through, again, it's a system that we have. Whereas, I look at it, I'm looking at it from a system point of view. The county's funding recovery innovation, our 24-hour crisis response center, we pay Alliance Health. So now, we're putting somebody there who then works with our post-overdose response team. That's being funded. We know that's critical. When people overdose, they're getting the Narcan that we're funding. And I'm just trying to talk about this as a system, right? And so that post-overdose response team is inducting people in the field with medication, medically assisted treatment, which is the whole point, right? We want to get people on MAT. We don't want to stop funding that. Then they get connected to the community, the linkages to care. And then the biggest pot of money is for partnering for harm reduction, because that is what works. And we know who does it best is the Harm Reduction Coalition. So that's why we're funding, working with them on the syringes and the Narcan. And this is all about saving lives. So what's more important than Narcan? And then that leaves us, the last thing it leaves us with is the funding for the jail for our medication assisted treatment program. So we don't want to stop doing that. So I do think we have to be really careful. I hope that we, and this is also at a time when we don't have any spare money. The county budget is really, really tight. So for instance, if we stop funding the MAT in the jail, then we're not going to stop the program. So we have to, then what do we do? Look at the county budget. Well, the county budget doesn't have a lot. So in other words, this is going to be very difficult, but we do need to be really careful. And I'm glad what I do hear you saying, Jason, is that we are going to have more money. You said 2.1 million. So if what the county funded programs, I'm just saying, if it stayed flat, for instance, 1.5, there still would be ostensibly 600,000 that could go into the community. So that's, another way to look at it. So I'll just stop here and just say I appreciate the conversation, because this is important to think thoughtfully about it, and also these are tough decisions to make. So thank you, everyone.
I'm gonna go to Dr. Carter.
Thanks. Yeah, I guess I think like the way that Wendy highlighted or Commissioner Jacobs highlighted the whole kind of system of care that's in place and how things are connected, I think maybe that's like why we're wanting to clarify this question about like how any cuts to the county is going to affect other programs, like Karen has said. I guess my question for Dr. Jenkins then would be, with the current, I guess, potential cuts or planned cuts to the county, are there actual staff or programmatic elements or work that's like currently being done that you're concerned will not be able to be done? Or you're pretty confident that like the work will still continue, you'll find, just with other funding sources or something like that? I guess that would be really helpful to clarify.
Thank you for that question, Dr. Carter. I do have slight concerns, of course, because I speak to my program managers. I let my managers do what they're hired to do. And there may be some slight concerns as far as like some contractual elements, but it's nothing that's going to stop the work. That's the bottom line. It's not going to stop the work. It's not going to impede our ability to affect the community and get the money out and get things distributed. So with that, I rest easy because I know that it's not going to stop the work. And also, Dr. Carter, there may be opportunities for us to get some additional funding once everything shakes out, be it internally or externally. What I've seen over the past 6 years is that we always find a way to get the money to get things funded. So,
okay.
Commissioner Jenkins said it best. It's not a lot of trees to shake. It's not a lot of dollars falling out that tree. But at the same time, for the county is per se, but at the same time, we still manage to do a lot with the money that we have, and we stay vigilant. We do our best to really look for other opportunities, and they always seem to find us. So I think we'll be fine, Dr. Carter.
Okay, that's good to hear, because I think I guess it seems like as the committee, like one of our options is that we could say, the current programs that the county is doing, that work is so important that we don't want to see any funding cut to that. And if that means that a greater, maybe our recommendation to the commissioners is that we want more of the money going to the existing county programs. It sounds like though you're fairly confident that the work that's being done will continue, and that we can feel confident that if we're recommending money going to the community programs, that's not going to take away from the county work that I think we all tend to agree like has been really great and we want to see continue.
It just does. Yes. And I'll just say it does my heart well because we internally are thinking about y'all and as much as getting the money out to the community. And I come to this meeting and it's the total opposite. You guys are worried about us. So yeah, my heart is about to explode because it's recognizing that what we have in place is working, and you want us to make sure that we have the funds to keep it working, and it just does my heart well. And I just want to say thank you to this committee. Again, you know, we're a well-oiled machine, and I do believe that we're going to come out of this thing on top. But yes, you all have some nice decisions to make. I'm going to get off camera and let y'all make those decisions. And with that, you know, again, rest assured that we will be fine.
Karen?
Thank you. Yeah. I'm still curious as to where the recommendation that the money gets split 50% county, 50% community, where that is coming from. Is that coming from the county commissioners? Where is that coming from?
Jason, you want to take this one?
Sure, I'll take it. Yeah, so one of the recommendation for that to come out was through the county management office, and so it was truly a question. So let me start here. So the funding of this really it starts at the county commissioners and at that fee. And so one of the questions that I asked when I received this $6 million request was, there's no way we're going to be able to do anything, in terms of, supporting the existing county programs and then also even entertaining any of these applicants. And so is there any way to may have an increase with the budget? And so, and where do we get that budget increase? We were able to get some interest income from the investment of the opioid settlement from the revenue that's come in so far, and that has been able to help generate a little bit of extra funding for us. And so, with that being said, and looking at our financial, which is only a few years in, we were, looking at what is possible for us to do. And the explanation that I received and the reply that I received was, we want to get more of these funds out the door. One of the and this has been a range. This wasn't like a hardcore. This was like can we do 60% out into the community? Can we do 50% out into the community? Once again, these are all like very loose recommendations. And so I think that's kind of the point of this conversation, is to say, what is it that you guys recommend? Are you guys recommending the opposite? And that's what I mean, to Dr. Jenkins' point, I'm with him on this. We're thinking about getting the money out the door into the community. And what I'm hearing from this committee is the opposite, getting it back into the county. So once again, these decisions really rest in you guys. This is something that I can also report back. And that's the point of this committee, to say, hey, they're recommending 40 out in the community or 30 in the community, and more into the county to really sustain those county programs. This is a decision that's at your disposal. And literally, I'm just here to present back to those individuals what you guys come up with. So I hope that answers your question. Once again, those were very loose recommendations. Those were our starting points as to what we could fare with the heart of transparency and the heart of fairness of how do we get this money to the county to continue to support county programs that are working well, but also how can we jumpstart and expand into other areas that we have not been able to do so just yet. So,
Thank you for that, Jason.
of course, Karen.
Is there any other discussion? So Dr. Jenkins is needing to leave the meeting right now. Thank you so much, Dr. Jenkins, for joining us and for answering our questions.
My pleasure. Please don't beat Jason up too much, all right? Thank y'all.
Thank you. Any other comments or questions before we begin to identify the strategies that we want to recommend? So we're going to start with the strategies first, and then we're going to move into looking at the applicants. But any other questions or comments?
Sorry, I have one thought as we go into this, which is that I think that I appreciate what Dr. Jenkins said. I also think that as Commissioner Jacobs pointed out, the county isn't distinct from the community. Like the county is like pretty inextricable from the community. And I wonder if, or perhaps like, I would like to propose that as we look into these, what strategies to fund, I wonder if it could behoove us to prioritize strategies that are already funded. And that way we can ensure that the county programs that are working get the money they need, and then bolster that that work in the community with any remaining funds. To potentially, like, that's like before, because knowing that we haven't undergone collaborative strategic planning yet, and knowing that we very well may next year decide to diversify where this is going, it would be good to be able to strengthen, I think, the systems that are already in place. So that's just my pitch. Sorry.
Thank you, Brittany. Yeah, I like that approach. And Karen?
Yeah, I wanted to say the same thing. I think that's a really good approach for this year. And I think if we do want to move into supporting more, NGO based programs as opposed to out of public health county, I think that should be done in an intentional way and in collaboration with the organizations that are affected by it. So I do think I would like for us to start with what we've already funded and talk about the real implications of any funding cuts to those people before we start. I mean, we want to address gaps, and I certainly don't want to create new ones, right? Let's not create gaps by cutting funds.
And Paul?
Yeah, I guess I just want to add to that. I had the same thought that, has been expressed by others, is that, it's all community. I mean, it's being delivered perhaps by the county, but it's all serving the community, which is really the fundamental charter here. And I think the other aspect to this one isn't it really ultimately our mission to ensure for this limited amount of money that we're doing what we can to kind of promote the best practices toward the needs that we have within our community. And how we do that, I mean, I think thinking about, in other words, versus the mission being we fund more community programs to be a part of this. It's really more a matter of what do we do so that we're responding to the need in the community in an effective way. And so I think, I was, as one of the reviewers, that's all I thought about. I didn't think about what pot where and who's got the money, who had it last year. And, I think that makes things kind of complicated. So, yeah, I mean, we're fortunate because we actually, I appreciate Commissioner Jacobs, what you had to say about the programs that we've actually been able to cultivate and build on and have some real success with is, why would we want to compromise that traction? So, we just, it's not a lot of money. I mean, in terms of what we have to work with, it's not that much money. And ultimately, the goal here is we're trying to just make a difference to an optimal effect with what we have to work with.
Yeah.
So,
And we're just beginning also the learning process as a group as well. I want, Dawn, you have your hand up.
I do. I understand what everyone has been saying, but I do think that we need to take advantage of this opportunity to diversify while we have the opportunity to do that. I did not hear in the discussion from Dr. Jenkins or anyone else that what has already been in place would come to a screeching halt based on us voting or suggesting that other programs be funded. And when I say diversify, I'm not just talking about the programs, I'm talking about the actual group of people that's going to be reached. So I think that's important. And I did not hear anything that Dr. Jenkins said that would cause that group of persons who are currently being reached by what's in place now not continuing to get what they need. So I would say that we take this opportunity to do what was asked, which was to look at how can we get the other 50% out into the community more, because it seems like public health has already, and community programs have pretty much been considered and covered. And so there's another spectrum of the county that needs to be considered and covered, which I think is what we're supposed to be doing.
So now are y'all ready to start maybe prioritizing the strategies that we want to recommend? Or is there other comments that someone wants to share before we get going on the process? Well, I will say I'm gonna just go ahead and recommend strategy 1, because that is part of our process that we're all involved in as a committee. And it just seems like for us to continue our work, we would need to have that support for the collaborative strategic planning. I know we have to do a verbal vote, so do y'all want to go one by one? Or do you want us to maybe come up with a group?
Lisa, could you pull up what you're referring to? Which document?
Yeah, it's the spreadsheet that Jason sent that has like the funding requests and the different strategies.
Could you put it on this? Could we have it on the screen? I mean, thank you.
Yeah. So strategy 1 is the collaborative strategic process that this committee is a part of right now and will continue over the next year or so.
So I wasn't clear. Is that your position, Jason? Is that what that is? I wasn't sure what that was.
It is my position.
Okay.
And this is actually a position that's actually required by the NCMOA. This is why we have a coordinator for every single county in the state. So it's actually one that's gratefully for myself that's not really able to be removed because it is tied to the NCMOA.
Okay. Yeah. I just wanted to get that clarified. Okay.
So we want to have a verbal vote about strategy 1. All those in favor, or should we go one by one?
Shalisa, can you just clarify, are we gonna just like go through each strategy and kind of say yes or no, like we want it, and theoretically we could recommend all of them, or how are we gonna compare them, I guess?
Yeah, that's a question I had too. Do we want to go one by one, or do we want to pick like a certain number and then vote? How would the group like the process to be or to go? Go one by one, or how many in total will be approved out of the 7? I think it's up for us to decide, Alonza. And there's actually 12, and it seems like there's just one strategy that there were no applicants, which was the employment related services. Dawn?
Yeah, I'm a little confused. So I thought, were we going to hear for the group purposes some clarification on what came out as being recommended, the programs that should be funded, and then deciding which ones to either support all or not all? I'm a little confused as to how we're voting.
Yeah, I think we're starting off first with identifying the strategies we want to recommend, and then next we'll look at the applicants under those specific strategies. Is that the correct? Is there any? Does that sound good to y'all? Or we could also possibly do it the other way, right? I mean, that is something, right? How would y'all like to do it? Look at each strategy and come up with a certain number we want to recommend. Go ahead, Dr. Carter.
Yeah, I think it's just a little hard to recommend a strategy without knowing like whether the quality of the proposal in the strategy is something that we support. You know, it's theoretically it could be addiction treatment, and it's like horse camp for people with addiction, and maybe that's not evidence-based, but they submit or something. So I think it's never really made as much sense to me to kind of figure out the strategies and try to rank them. I think I felt like the MOA kind of decided that like these are all like valid and important strategies, and we kind of want to see work in all the areas, and so we need to be sort of looking at the actual proposals too.
Right.
Thank you. And Paul, and then Commissioner Jacobs.
Yeah, I think that's what I was going to say is I don't know what we wouldn't want. I think the question is what do we need to to address any and all that are important, which are all of them. And I think just as a reviewer, I think part of our conversation had in thinking about what we recommended had to do with how well we were already meeting that need and what what gaps there otherwise were related to other needs. So that's why I'm not a little confused about
Mhm.
uh, um, what we wouldn't be recommending here. I mean, because yeah, and I think I thought we already kind of talked about this is what we're all after in our community. But as goes the proposal discussion, that was more, I think, based on decisions that took into account what we already had and who was providing that and how well were they providing that before we thought about dedicating funds to something new that would be either competitive or repetitive.
Commissioner Jacobs.
Yeah, I mean, in order to make an educated, informed decision about any of this, I think we would need to see all of the applications, what the budget is, what are their performance measures that they are going to be trying to achieve, how many people are they going to be serving, all those kinds of things. I don't know what type of analysis has already taken place by the committee, but that's the kind of detailed information that we would all need to make an educated, kind of informed recommendation. I mean, that goes for all of the currently funded and also the ones that are being, because at this point it's just a name and a number on a piece of paper. So I don't think we have enough information based on the spreadsheet.
Yeah. So maybe we could look at the scoring, because it does have like the criteria that was used to review the proposals. And that includes, like, for example, organizational readiness, how integrated the group is with the county, also measures and program evaluation. So maybe we should look at those.
Yes, that's definitely a lot more helpful.
Okay.
Yeah, and I could just respond to say that's exactly what we did for those of us who did reviews, we looked at all those metrics and measured everybody by those standards. So that was part of what we did to make the decisions we did in terms of the votes we had at that point.
And Jason's asking, did everyone receive the applications? Okay. And then Karen, and then Dawn.
So I'm wondering about starting out with what we know, if we start out with what we know we want to have, what programs we know we want to have funded. For example, we know strategy 1 needs to be funded, right? So we're done with that one. Like, we have to do that, and so I'm wondering if there's any other ones that the group like has consensus around not wanting to. I mean, maybe we start with the ones that are already happening. Are there any of those that we know we want to continue to happen? And then we can kind of figure out, okay, well, what's left over and how much more is there that we can fund, and then go from there. because I think the bottom line is there's a lot more good ideas than money. So for me, I think I'd like to know, like, how much money do we know we already want to commit, and then kind of see what's left.
Lisa, I think you're muted.
Yeah, so Commissioner Jacobs is asking for if you could resend the applications, and then Dawn is the next person who has their hand raised.
Okay. So I feel like we have complicated what we're supposed to be doing. I thought what we were doing is that these were the 7 or 12 strategies that have already been established. And then these organizations submitted RIFs based on what they thought fit the strategy. And then there was a separate group that looked at those applications based on the metrics and voted or ranked the ones that they thought best fit the strategy that has already been decided. This is what we're going to do with this opioid settlement. And then I thought that we were supposed to look at what was ranked and decide whether or not we want to submit those that were ranked under each strategy to the commissioners for their vote to decide whether or not to fund. Am I correct, Jason?
You are correct. That was kind of the purpose of pulling out the initial three to kind of get and the other two as well to kind of get an initial look at all the applications and then rank those and then bring them to the full committee. So that way the full committee would have time to one, review the applications that I sent out as well, review those, and then come to this meeting, looking at their feedback, having your own feedback, and then presenting out your own informed vote. That is what was supposed to happen for this meeting. And if it needs to be helpful, I'm more than glad to kind of walk through what people are proposing as like a quick high level, situation because not everyone here is like so when people submitted their applications, if you when you get a chance to look at them, many people didn't realize that in their applications, they're overlapping multiple strategies. So it may be for treatment, they might have housing support in there, they might even have a peer support specialist wrapped around in there. From our angle, that is then split up across three strategies, even though it's one application. So the funding component that we're talking about can kind of get a little bit confusing, simply because of how it's broken out from the application. So if you have a housing component up there, and I mean, if it's like Oxford House, like they had rental, they had a lot of housing support there. That was a real clear cut ask there for Oxford House. Okay. And then you have something like Southlight who asked for a peer support specialist. All right. So they also have some housing components in there, but some of that funding might, and I have to get clarity on this, but it might roll into some of the peer support specialists because the opioid settlement funds are restricted funds. You can only distribute funds out of that restricted strategy, if you will, if that makes sense. So a lot of the applications overlapped with multiple strategies in there. So I've had the fine job of having to tease those out a little bit and try to make this to make sense. So once again, we had evidence-based strategy. We have five organizations for evidence-based strategy. Excuse me, for evidence-based treatment, addiction treatment strategy two. The two that came on top was BART and also Morse Clinic. BART, I think they just asked for, it wasn't a large amount of money that they were asking for. When you look at the application, it wasn't a large amount of money. They were just looking for some financial, I think, copay help across treatment. That's what they were looking for that one. I think for Morse Clinic, they're looking at doing a partnership with Duke University Hospital as well with the Comet team, and they're doing there's a couple different parts to it, but essentially it's the Comet team will be doing the assessment from the ED and then having a rapid referral access to MOUD. Also they have a lot of personnel in that application, but the whole point is those that are coming to the ED to be assessed and then having this rapid access to treatment to the Morse Clinic. That's their proposal there. All right, those are the two that came about, and it's more so like, do you guys agree with that? If not, do you guys want to consider bicycle health and also reliable health services as well? So you can either kind of go with the recommended strategies or not. Same thing with Recovery Innovations, I believe RI. I think they actually, yeah, RI and I think the Department of Social Services, that's not even in this space anymore. But Recovery Innovations, I think it's like really the only one in the recovery support specialist, which is the CLC program. So do you guys want to continue funding them? Kind of a yes or no. And then it's like recovery housing. Do you guys want to look at South Light and Optra House? Do you guys recommend funding for these two? Yes or no? When you get to naloxone distribution, public health in the county is already kind of squared away because that funding is already squared away with the other 50%. But the other 50% that you potentially could use or have or recommend is do you recommend putting TRI in that space or North Carolina Harm Reduction Coalition, which I think they actually fall more into the SSP based off of their application. So that's a yes or no. Same thing for number 9. It's the same thing. It's Department of Public Health. That's kind of another 50%. It's kind of squared away already. So you don't have to worry about that losing anything. It's kind of squared. And then you have the North Carolina Harm Reduction and, and there's there's funding them or not. And so to kind of get a sense, of what is it a yay or nay? Are you do you want to recommend these applicants or no? Hopefully that's helpful. But that's what we're looking to do.
Is that helpful for everyone? And so we'd like to go just kind of like how Jason just already described, and then we could also, if someone has a question or you have a comment after because you reviewed the application, we could also have some discussion. But how do y'all feel about that process? We just go through and make a recommendation, verbal recommendations, vote to make a recommendation based off of the application scores.
Jason, when we were reviewing applications and sort of in our small group, kind of trying to come to a consensus on the different proposals and sort of came up with these recommendations, I guess. It sounded like part of the work after that step was going to be that you were going to be like working on scaling back a lot of the budget asks, essentially, because either some of the stuff that was asked for was not actually appropriate to be covered with funding, or just like in order for us to be able to dispense the money to as many groups, like we can't fund like an entire staff for someone or certain things. So I was just curious if you could give like a brief update on like did that work out to the point that you feel like because it feels like this is a lot of potential things, and I don't know if we say, yeah, we like all these, does that mean that like none of them are going to be able to get enough to do what they want to do, and we actually should be trying to pick half of them, or sort of like where are we at with kind of the budget?
Yeah, absolutely. So obviously we are, if you look down here and let me see here. So obviously we are about 400% over the budget here. This is what we got here. And it's actually probably a little bit more than that. We've actually scaled down afterwards. And to your point, Jamie, I did exactly what we said we're going to do. And I actually reached out to the organizations and kind of gave a really tentative preliminary, hey, this is what we're looking at. This is what kind of the early look of things are. And we still need to go to the committee to get a full recommendation. However, I did ask, I said, what, and all the organizations that are watching this, they know I've already had these conversations with each one. I said, which of these are most important to you in terms of what was on your budget? And another thing is some of the things that was on people's budgets are not actually eligible. And that's what Kristen was mentioning earlier. They're not actually eligible according to the NCMOA. And so we are under option A, which requires direct services. So there's a lot of things that are eligible, a lot of things that are not eligible. So unfortunately, there were things that we were just not legally allowed to fund because they do not comply with NCMOA. So they were just giving us their needs. So based off of that, I also went to OSTAT, so to the OSTAT team with Nitty, you guys are all familiar with them. I actually ran this back through them as well to also vet it as well, because they also have to approve it on the back end after our commissioners approve this. Okay. I actually do it on the front end because the last thing I want to do is approve it on the front end and then submit it to them. And then they say that's not allowable via the MOA. And then we have to go back and it's a whole mess. So yes, we have scaled down the budgets to each of the recommended organizations. If they are fully recommended, they will have enough to do what they said that they want to do.
Okay.
So it's the recommendation is now up to you guys whether you guys want to fully recommend them or not.
I guess, Jamie, if I understand your question, were you asking like, is there a way to fully fund, or like not fully fund, but like, is there's a way to like, if we recommend all of the orgs that are currently like recommended from this process, they will all be able to get the funding that they need to get it done? Or do we need to like make like, right, do we need to like make priority decisions?
And I'll add one last thing too. We don't decide funding allocations. That is the county commissioner's job to do so. We are giving out recommendations, and then ultimately they're going to decide the funding, what that looks like.
Absolutely. I guess
Okay.
my question is just
I see.
I think it helps in other funding decisions that I've been part of to understand like about how many can we reasonably afford to fund and still get them what they need to do what they said they were going to do.
I think the 7 that were recommended is probably the most, the max, if that helps you out.
Mhm. And Jason, could you show that spreadsheet again, please, with the scoring?
Sure.
Thank you. And so these are all the groups with who their final scores are bolded.
And I think this one dropped out. I think a few of them did drop out as well. Just so you guys are well aware. I know my scratch out is here. But I think this one came out. And also Try, I've had a conversation with them. They took themselves out of this one as well. So the kind of recruits or took themselves out of these. I think those are the only ones that were there. Yeah.
So the program that was like the peer support specialist is a part of the justice services, like that's taken out of the running. That's no longer.
That is.
Okay.
Yeah.
But the justice services, like I guess the family treatment court, is that part of the county funding, or is that one of these ones?
Yes, it is a part of the county fund. It's part of the justice services program, but I think that they're partnering with someone else. I'm not 100% sure on that one, but yes,
Okay.
it is county run.
Because I know Dawn, I mean, maybe this is too much of a conflict of interest discussion, but I know Dawn was feeling like there needed, that it would be really beneficial to have more integrated work within the Department of Justice and services or whatever. So it sounds like that's still being taken care of, even though they're not one of the ones that's on this current bolded list.
Yeah.
Okay.
Do you mind just zooming out just a little so we can see the final scores for the folks on the right? Thank you. Sorry if that interfered with people's vision.
Dawn, your hand is up. Go ahead.
It is. Jason, I have a question for clarity. So the recovery support services, justice services, that's the one that was been removed, correct?
Yes, ma'am. That was actually removed.
What happened with the justice services drug treatment court?
That request is still active on the county side.
Okay.
Go ahead, Karen, and then Brittany. Oh, you're muted, Karen.
Thank you. I was just gonna throw out the idea of that we, maybe focused first on these organizations that got, 85 and above, as a place to start. I'd love to hear from the reviewers, but I see some bolded scores that are like in the low 70s, and that makes me nervous to recommend applications that had unfinished sections or the score for the scores on some of the areas are quite low. So I just wanted to put that out as a starting point.
And Brittany?
Yeah, I appreciate that point, Karen. I also am curious about, it looks like under strategy 7, try is the recommended recipient, but NCHRC had a significantly higher final score, and I'm curious about how that decision was made.
Yeah, absolutely. I think once again, some of the applications, and I've already spoke with NCHRC as well, just to get clarity around their applications, and a lot of their work actually, their application and their specific ask, which is in the application, it actually kind of falls under the SSP program specifically. So I put them in both initially because I mean, it's both under harm reduction, but I think what their specific ask was and the need was, it kind of fell under SSP. And how do we determine that? Is what are we expending out in terms of this strategy has to fall on, I mean, from the application has to fall under that strategy. So obviously in the lock zone, we spend out in the lock zone. We're not, can you distribute it through all? Yes, to some extent, but generally out of the naloxone strategy, we can't distribute out another strategy as well. So that's why they're in two places.
Commissioner,
To be frank, I mean, many of the applications fall across many different ones, and that's a nightmare that I would have to deal with outside of these meetings, and how this actually works out from a financial end. So.
Commissioner Jacobs, you can go ahead.
Yeah, I just was noting that we don't have much time left in this meeting. And I think that one of my takeaways is it sounds like maybe Jason, does there need to be like an updated information that's given to people, or that some of the I just wonder if we're ready to. I think people have asked a lot of really good questions. I'm not sure we have all the answers at this point in order to kind of make any recommendations. This has been a great discussion, but I know I have a lot more questions than when I came into it. So I just wanted to wonder what people are thinking about next steps, looking at the time right now.
Yeah, Jason, I wonder about the timeline too. When do we definitely have to have these recommendations ready and sent? Next month before next meeting?
It'll have to be ASAP. Like I said, we're running close to county deadlines. And so I think this is what happened to us in the previous years. Before we even had this established, we went with what was currently working and we moved the funding. And I just also want to say this to Shalisa and everyone else is that the kind of the issue that we're having right now, the challenge that we're having right now, it makes perfect sense. Because the recommendations are supposed to come at the end of a collaborative strategic plan. And we are at the beginning crutches of that. We're at the learning sessions of this. And so that is what's making this challenging. And it makes perfect sense why it's so challenging, because this is supposed to come on the back end of all of the front loaded work that we're actually actively doing. And so I just want to commend you guys for this type of discussion and all the questions that you guys are asking, because they're perfect questions. And I think that we're actually in the right space, in the right direction, even though you may not feel confident on your recommendations just yet. So let me know what you need. I'm more than glad to assist to help you guys make a decision. I would say yes, we probably need to make a decision. If we don't make it tonight, it would have to go in the next couple of weeks. We have a process in which we need to contract out with organizations, the ones that we're currently funding. We have to still put those in within a reasonable amount of time, and we also have to get this to the commissioners before the fiscal year. So, and that also takes a lot of time as well, planning. So. I'm at your disposal. I mean, let me know what you guys need to make a good recommendation.
Sure. And so Dawn and then Dr. Carter, and then I would like for us to make a proposal about what we're going to do, because we do only have about 5 minutes left for our meeting.
Okay, so I was going to suggest, because of how the meeting was going and there seems to be a lot of unreadiness, that would it be possible to recess this meeting and hold a special meeting maybe one day next week, a short period of time to give persons who didn't have the opportunity to review the applications, review the comments made by the viewing team that was included in the sheet that Jason sent out. So you will know why the ones that were recommended. And then hopefully we can come back, maybe I would say maybe a week or so, to give our recommendation so this process can move forward, would be my suggestion.
Thank you. How does everyone else feel about Dawn's suggestion for us to reconvene next week? And is it possible for us to go ahead and find a time to do that? Okay. I'm seeing a lot of thumbs up. Do we have to go ahead and have like an official verbal agreement or verbal vote on this, on deciding on a special session for the committee to meet? Okay. Does this time next Wednesday, how is this time for everyone next Wednesday, which is going to be the 15th at 5? I'm seeing some thumbs up. I'm seeing some folks are still checking. Karen, I see you have a, okay.
Yeah, I have a conflict.
I think I have a Lincoln meeting at this time, Lincoln Community Health Center. Let me just check.
If there's another day next week too, that would be better. That's fine as well. We want to have as many folks here to be able to, first of all, make these recommendations and make sure we have quorum.
Yeah, is it possible to start? I do have a Lincoln board meeting at 5:30 next Wednesday. Is it possible to start a little bit earlier? Does that conflict with people's work?
Earlier, like maybe what, 4 p.m. next Wednesday? Who's up? So folks saying yes, nodding yes. Okay. So we're gonna get back together to okay, and Alonza says she's still working at 4.
Yeah, I am too. And based on this group, there's no way in God's green earth we're going to be done within an hour and a half for her to make it to our 5:30 meeting. So
Right.
we might look at another day.
What about Thursday 16th or Tuesday the 14th?
I'm not available on Tuesday the 14th, but I am available on Thursday.
You know what? If the 15th works the best for everybody, then just go ahead and with that.
Well, can we still go with the earlier time? That would work better.
No, I mean the 4 doesn't work for people.
Yeah, the 4 doesn't
Oh,
work.
4. Oh, that's right. Okay, I'm sorry.
Yeah. So
okay.
yeah, so just that's fine.
Okay. So, and also Karen said that she has a conflict on the 15th at 5.
What about Thursday?
Yeah. Thursday at 5.
Unfortunately, I think I have to work a lot of nights, so I think I also have a conflict on Thursday. But I could always email in my thoughts
Okay.
if I'm unable to make it.
Yeah, just to be clear, you can email your thoughts, but not a vote.
Mm-hmm.
Correct. Yeah, I understand. I trust the committee to make the right decision if I'm not there.
13th.
So Thursday the 16th at 5.
Let's, if you all don't mind, just take a vote on it when you have the set time.
Okay, so we're going to take a verbal vote on getting back together next week on Thursday, April 16th at 5 p.m. to make recommendations. Everyone in favor, say yes.
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 Yeah.
Yes.
Do we need, I'm so sorry, Christy, do we need to do a roll call vote?
I think it needs to be clear who voted what, but if it's unanimous, it will be clear. So I would say if any
Great.
vote, just state your name.
Thank you.
Anyone opposed? Okay, so we're gonna get back together next Thursday, the 16th at 5 p.m. to make our recommendations. We're already at 6:30, y'all. So thank you so much for this. Has been like a really we didn't get everything done, but I think it's been still a great meeting. And then next week, looking forward to seeing everyone again. So thank you so much, everyone. Actually, we have to call for a formal adjournment. So did we have a motion to adjourn?
I motion to adjourn this meeting.
Thank you, Alonza. And a second?
I'll second.
Thank you, Paul. And everyone in favor, please say aye.
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 All right. Anything else? Okay, so we'll be back together next Thursday. Thank you so much, everyone.
Good
Bye-bye.
night, everyone.
Thank you,
Bye.
everyone.
Thank you.